Further ado, I will turn it over to our wonderful moderator, Professor Rebecca Nelson. Rebecca, I think you're on mute.
Sorry, I'm thanking and welcoming everyone in a silent form. Anyway, so thanks again to everyone for being here. Of course, a huge thanks to our fabulous lineup of speakers for today. I think we've got a really wonderful set of presentations coming to us here. But before I introduce the speakers, let me thank Lauren Barredo and Linda so they are working for the Sustainable Development Solutions Network, Lauren in New York City and Linda at Wageningen in the Netherlands. And they've been powering a number of these sorts of features for a while. So a huge thanks to them for all the work they've done to put this together. And also they'll be very actively involved in this moderation process today. So the conference to date's been, I think, really terrific. On Wednesday, day one, we heard from Tom Wassenaar, a Dutchman working out of France at CIRAD, who told us about the issue at hand and the potential for resource recovery from sanitation and other organic waste streams into agriculture. And also Johannes Lehmann, a professor here at Cornell, who has looked at particular ways, he's a soil scientist looking at particular ways to transform resources, particularly pyrolysis, to turn them into resources for soil. And then yesterday, we had Sasha Kramer making a presentation about her ecological sanitation company in Haiti. So we started with Haiti, then we moved to New York City, where Jennifer McDonald talked to us about how solid waste is management in that metropolis, 4 hours from where I'm standing right now. And then Renzo Ackerman, an operations researcher in the Netherlands at Wageningen, told us about some of the sort of generic issues for managing these waste to value chains in a country, the Netherlands, that's very serious about its circular economy idea. So, so then today we're turning our attention from Haiti and New York, so this hemisphere, to Africa now, where we have two very successful ecological sanitation companies. Davis representing Sanergy, Davis Ireri representing Sanergy, and Jane Wambui Mugo representing Sanivation. And then we'll hear from the wrap-up speaker will be David Berendes from the Centers of Disease Control and Prevention, with some thoughts about some of the risks that we're managing with these efforts. So I happened to have dinner last night with a person who's running a huge sanitation effort around the world, and the idea of resource recovery was not foremost on his mind. So I feel that with this conversation about resource recovery, speaking as someone who's involved in agriculture, is really a huge needed conversation. And having the innovators we have on the line today is really, for me, a tremendously exciting thing. So I would like to now introduce Davis. I had the pleasure of meeting Davis a couple weeks ago at Sanergy, and he's the kind of person that just gives me hope that we can possibly do something great on this planet. He's a super innovative guy, got his education at Jomo Kenyatta University in Kenya, and has worked for Agro Solutions, a company in Kenya, as well as Reform Educational Network, having some features in common, I think, with SDSN. And now he's working on the value chains, several value chains for Sanergy, and I'm sure he'll tell us about that. But I was super excited to meet Davis, and I'm really grateful to you, Davis, for joining us today. And I'll introduce the next couple of speakers right before their presentations. And just to say that we'll try to allow 1 or 2 questions, that's at Lauren's discretion, after each speaker, and then try to open it up for a broader conversation at the end. So Davis, thank you for being here, and over to you.
Thank you, Prof. It was nice, as you said, it was nice meeting you in Nairobi some couple of weeks back, and I'm glad to get an invitation to present in this e-conference. And it's a nice thing to see people talking about resource recovery and how various people in the world can interact in such a forum to exchange ideas and actually take this world to the next level. So I think without further ado, maybe I should I go direct to my slides? Or,
yeah, go ahead. Please do.
Yes, yeah, thank you. So I'm trying to share right now, and just to ask if everyone is seeing them. And now I'm on presenter mode. presentation mode. So
Perfect.
yeah,
Yep.
yeah. Okay, thank you. Yeah, so just to introduce myself, I'm Davis Ireri, and I'm representing Sanergy, a sanitation and waste recycling company located in Nairobi, Kenya. You know, Nairobi, the land of the Lion King. Yeah. And today I'll be sharing Sanergy's work on recycling organic waste streams into high quality agricultural inputs to reduce pollution of waterways, restore soil health, and improve animal nutrition. And just to give a little bit of background, cities around the world are growing really fast, and with this comes a lot of challenges. For example, today 1 billion live in urban slums, where existing infrastructure is struggling to actually keep pace, and 90% of waste, according to the World Health Organization, 90% of the waste which is generated in these urban slums is never treated. Specifically in Kenya, over 8 million people live in slums where the sanitation waste generated is improperly managed. And on my current slide, if it's on real time, that is Nairobi River, which traverses Nairobi city. I pass this river every day. I'm going to work. Every morning I'm going to work, and every evening I'm leaving work, going back home to rest. 66% of sanitation waste generated in Nairobi ends up untreated in that river, and this causes devastating health and environmental challenges. In addition to sanitation waste, Nairobi also produces a significant amount of solid waste that is illegally dumped. The city generates about 1 million tons of solid waste per day, per year, and only 50% is collected, let's say safely collected. This translates to over 2,000 tons of organic waste daily, and most of it ends up in landfills and rivers, losing the economic opportunity to be repurposed. There's a lot of economic potential in this organic waste which is generated in Nairobi city. At the same time, Kenya is facing significant challenges in increasing its agricultural production to meet the demands of the growing population. Current population between 45 to 50 million. And agriculture is the livelihood of the Kenyan economy, with around 80% of Kenyans relying on agriculture for a living. However, one of the biggest challenges affecting agricultural productivity is declining soil fertility caused by overutilization of farmlands and chemical fertilizers, leading to poor soils, weak plants, and poor yields. In addition, there is no sustainable protein meal for animal feeds available so far. Most people relying on fishing to get the fish meal as a protein source for animals, or soy meal, which is very expensive because it's not grown in Kenya. And that is why we at Sanergy have come up with a circular economy approach to tackle these issues and provide sustainable solutions for emerging economies and booming cities around the world. It involves, as you can see on that slide from top, collecting, transporting, treating, and converting organic waste into high quality end products. Into details, currently we collect over 600 tons of waste from our container-based sanitation facilities, as the one you can see on the screen in Nairobi. Also collecting waste from catering and agricultural sources across Nairobi city. Catering sources includes the big hotels and any kitchen outlet we have in the city, and agricultural sources include agricultural processors and any agricultural waste which you can get either through a processor or through markets and any other source any other sink of such kind of waste. Then also daily we safely and professionally transport all waste with our fleet of trucks and sealed container system to a recycling facility. This facility is located 45 minutes out of the city, making it very convenient for such kind of operations. So collecting waste, and within 45 minutes it's safely and professionally in our recycling facility. We then convert all these waste at our central processing plant, whereby we develop 100% of this waste is converted into useful end products. Number one of this product is, as you can see on my slide, there is high quality organic fertilizer, which restores soil quality and structure for Kenyan small scale farmers or smallholder farmers. The second one, the second picture, which is on the left, or the left of that slide, is insect-based protein derived from black soldier fly larvae for animal feed. And then on the right, bottom right of that slide, we have biomass fuel briquettes, which we use as renewable energy source to power operations, promoting clean energy and reducing deforestation. So let me maybe dive deeper into one of the products which has shown high quality, high potential in restoring soil health. As mentioned in the previous slide, we produce a high quality organic fertilizer with the commercial name Evergrow, as you can see on that slide. This product is sold to smallholder farmers across the country. And amazingly, farmers using this organic fertilizer have reported a yield increase of up to 30%, which is quite amazing. What then are the key drivers to its stellar performance as indicated there? 30% yield increase is not something small for a smallholder farmer. It translates to a lot of money. And the key drivers includes, and are not limited to the following. Number one, it adds soil nutrients. We have, through our thermophilic decomposition, we have developed an organic fertilizer from waste which we collect from Nairobi city, which has a greater density of available nutrients. Infusing this fertilizer, which is Evergrow, complements nutrition regimes and enables maximum uptake by plants because it's a slow release fertilizer in which most of the nutrients are taken by the plant. It is also rich in humus and organic matter, which helps improve soil structure. This hence also helps in having a better soil water retention. Soil water retention is essential to life, plant life actually. It provides an ongoing supply of water to plants between periods of replenishment to allow for their continued growth and survival. This feature is very essential in a country like Kenya, where most parts do not receive adequate rainfall and are either classified as arid or semi-arid. With a balance of humus, which is a key component of this organic fertilizer you have developed, and organic matter, and a variety of macro and micronutrients which helps to create a living soil rich in carbon and beneficial microorganisms, Evergrow also helps to balance pH and enhance water retention as mentioned. Repeated application of Evergrow also helps nutrients become more available to crops, making the soil more fertile. Over time, less chemical fertilizers are needed in this, and that is why we have seen actually a good performance from our own in-house trials, and also maybe when we visit farmers who are currently using Evergrow, the organic fertilizer we've developed from waste. To put the mention into a general content in that slide, what simply we can describe Evergrow as basically a feeder to the soil, and then after feeding the soil, the soil now then feeds the plant. So Evergrow basically feeds the soil, which in turn feeds the plant with the nutrients. As simple as you can put it. And one of the farmers, if I may take a case study of one of the farmers who have greatly benefited from the use of Evergrow, one of them is Mzee Kibiti, who does his farming in Isiolo. Isiolo is the eastern side of Kenya, which is literally very dry and it's not good for farming. But when Mzee Kibiti started using Evergrow, he realized a yield increase of up to 60%. In terms of income, he was able to fetch an extra 128,000 Kenyan shillings per acre. This equates to 1,280 US dollars from a small scale farmer. This is a lot of money considering the Kenyan economy. And this is in 3 months because he was doing tomato, and tomato takes 3 months. So 128,000 Kenyan shillings in 3 months is quite a lot of money to a farmer. This all due to the mentioned benefits of using Evergrow, which enabled crop tolerant to major tomato diseases, a high-grade fruit, which we also observed, resulting in an early and bigger harvest. And how do we then distribute Evergrow to make sure that it reaches the target audience who are small-scale farmers who are trying to improve their livelihoods? We sell Evergrow actually across the country using a reseller model across Kenya, using a reseller model. The resellers are located in counties. Kenya is divided into administrative counties that make up territories, and territories make up a region. Let me explain that. So resellers, as you can see on the map which I'm currently presenting, we have areas shaded in different colors: gray, orange, purple, and light purple and dark purple. Those are the areas which we are calling territories, which are combined, which are odd potential areas for horticultural farming due to the climatic conditions which the areas receive. So resellers, in this case, resellers are shops or farmers who are as close as possible to the end user. In this case, the end user being the small, older farmer. We sign up resellers who then stock our product and sell directly to the end users. The resellers get the product at a wholesale price from Sanergy, and we sell it to the farmers, and then they sell it to the farmers at a retail price. We have clustered high-performing horticultural pockets next to each other, irrespective of the county boundaries, and these are what we are calling the territories. With this, we have been able to achieve reasonably sized territories which we service with a county sales rep who then mans the county offering agronomic advice and sales, and also leading the sales and marketing initiatives in those territories. And this is not easy. The main challenges we have encountered over the past years is to increase the uptake of the products of this product. And one of the challenge is it takes up a very long time to actually penetrate a territory and ensure that farmers are shifting from inorganic fertilizers to organic fertilizers, which are really beneficial. Second, it takes a lot of time and training to encourage farmers to use, as I said, organic fertilizer to restore their soil. They are used to only using chemical fertilizers and manures, and we need to change behaviors to go back to sustainable agricultural practices, and which are not harmful to the environment and also the crops and also human health. And our goal is actually to cover all the targeted territories on the map, which I'm currently displaying, by the end of the year, which is a tall order. And building on the successful results of our current facility, we are now scaling up our operations. It's good to note here that we are building the biggest organic waste processing facility in sub-Saharan Africa. This facility we are building is going to be processing over 72,000 tons of waste every year, producing 9,600 tons of end products, in this case, they include the fertilizer, the organic fertilizer, the animal feed, which is dried black soldier fly larvae, and the biomass briquettes, which are used as a renewable energy source. And to add to this, by the end of the year, but with these targets, we are going to be serving approximately 5,000 by December 2020. This is quite a huge impact, considering that it requires a lot of time, and we usually encounter a lot of challenges and a lot of competition from the inorganic fertilizers. But slowly, we are going to get there. 5,000 farmers all using organic fertilizers, which have very many benefits. Then it's quite a huge advantage, and that's why we are calling everyone to join us as we build clean green cities of tomorrow. And by this, we can only make sure that there is no waste in these cities, and that we are actually converting all these waste generated in these cities into useful agricultural products, as we as Sanergy are saying. And thank you very much for listening, and I'm now open to questions and comments about our works at Sanergy. Thank you.
Well, thank you so much, Davis. That was really exciting presentation. Lauren, are you going to be the one, or?
Yeah, so we have a couple quick questions for Davis before we move on to our next presentation. Linda is interested in the farmer side of the product. I'm going to ask like 3 at once. I don't know if you want to take any notes. Linda's asking about the farmer side of the products and how the prices for your fertilizer compare to those of your competitors. And then we have a couple questions from Johannes. He's saying, are you collecting only the organic wastes? And have you checked the organic fertilizer composition? I'm assuming he means the NKP breakdown. I also see a couple more questions, but we're going to ask these for now, and we'll save the rest for the longer Q&A.
Okay, yeah, so our fertilizer, actually comparing it to the conventional fertilizers, which are the inorganic fertilizers, we are very cheap as compared to the inorganic fertilizers. For example, one of the most commonly used fertilizer in Kenya, which is DAP, diammonium phosphate, which is inorganic, and NPK, which is a combination of nitrogen, phosphorus, and potassium. A bag cost around 3,000 Kenyan shillings, which is around $30 per 50 kg bag. We package Evergrow in 50 kg bags also, and we sell a bag at around at half the price, which is $15 per 50 kg. So you can see actually it's almost half the price. So to the sellers, we sell it at $15, and then they sell it at $17 to the small scale farmers. So around maybe as I said, maybe that's about half the price as compared to the inorganic fertilizers, and you can see the advantages it's giving to the farmers. About collecting waste, yeah, for now our model only allows for collection of organic waste, but we have to admit that there are very many challenges with collecting only pure organic waste, whereby in Kenya we don't have like the source separation rules quite, or regulations quite enhanced. So for example, when you're collecting from maybe markets, we'll find a lot of inorganic waste, but and also from our container-based sanitation facilities, we also get a lot of inorganics, a lot of plastics. But what we do as our first line of treatment in organic in our facility, we actually do a separate. We have a separation stage whereby we separate the inorganic waste and the organic waste. The inorganic waste we then now sell to vendors or to processors who process inorganic waste, and then now we are left only concentrating on the organic waste. About composition of Evergrow, yes, we have a good breakdown of nutrients. First of all, to be able to sell Evergrow in the market, which is organic fertilizer, we have to be certified by the Kenya Bureau of Standards, which have actually been certified. And for that, we must have achieved the organic fertilizer standards and that includes having a minimum nitrogen, phosphorus, potassium, carbon, and any other micronutrients which should be checked in an inorganic fertilizer. So we have that, and we make sure that at any time we are mixing feedstocks to help us achieve the best nutritional mix to help us be certified by the Kenya Bureau of Standards. Also, currently we are working with the EcoCert, which is an European an international certification body. They have their own also minimum nutrients requirements, and we must achieve that for us to have the product in the market and certified by EcoCert, which is a certification body. So about nutrients, for any fertilizer which you make and has not reached the nutrient standards, we have to reformulate again and then compost again to make sure that we have attained the minimum nutrients balance for an organic fertilizer which should be sold in the market.
Well, thank you so much, Davis. Good question, great answer. I am curious about the fertilizer cost per kg, but also per unit nitrogen. I think those are going to be some interesting discussions we can have going forward. But for now, with great thanks to Davis, let's hear from our next speaker. Next up, we have Jane Mugo, Jane Wambui Mugo. She is a sanitation officer at another very successful Kenyan circular economy for organic matter company, Sanivation. And she's a social entrepreneur. She's worked extensively in the water, sanitation, and hygiene sector and community development in towns that are urbanizing. And she began in 2015 when she founded her own cleaning company that recruited women from vulnerable circumstances into professional housekeeping and cleaning skills. customer service and leadership. And that put her in a great position to compete for this job at Sanivation when that company went to scale their container-based sanitation toilet scheme in Naivasha, a town not so far from Nairobi in Kenya. So in 2016, she was selected for that role, got a lot of training, and now she's going to tell us about her work. She's had also training in media and communications, business management, and she's now working to further her skills in training and management and leadership at the University of Africa, the Management University of Africa. So she's got experience in M&E, health and safety, and really looking forward to hearing what Jane has to tell us today. So over to Jane.
Hello.
Hello.
Thank you very much. I am so happy to be here to share with you the key learnings from 6 years of on-site CBS operations in Kenya. My name is Jane Mugo, once again, from Sanivation in Naivasha, and I'll go straight to our slides for today. Are they, can you see them?
Not yet. So there's the share screen at the bottom that you might need to click, and then I think you might even need to give it permission or tell it which window you're looking at. There we go. Yep.
We good?
Great, but they're not full screen. Yeah, perfect.
Okay.
Oh, fantastic. Yeah, great. Thank you, Jane. Awesome.
So Sanivation has been operating CBS for the last 6 years in 2 areas in Kenya. One of them is the peri-urban environment near Nairobi in a small town called Naivasha. It is around Lake Naivasha. The other area is at the Kakuma refugee camp, that is the northern part of Kenya. And at peak, we have served over 3,500 people in Kenya. Our CBS model consists a household toilet with a twice a week servicing to treatment and transformation of waste to a charcoal substitute solid fuel. Sadly, at the moment, both our CBS operation sites are not on operations due mainly to lack of sustainable financing to achieve scale. Though we do still believe that CBS is an important sanitation solution, which under specific contexts provides the most cost-effective solution for household access to safely managed waste. Our models were different. The one in Naivasha is an in-house toilet that consists of a portable urine diverting. That means it separates the urine at the point of collection. And the other one is in Kakuma. It is the same, though it is built outside in the camp's compound in a superstructure that is also locally available. Some of the benefits from operating the CBS, it's low cost in investment because the materials are locally available. And for instance, one of our clients, her name was called Mary. She was a customer for over 5 years. Mary had space to construct a toilet, but she could not afford the toilet, the cost of construction, which is about $250 to construct. So Mary opted to subscribe for 2 toilets for her household. Also for the tenants, they do not have options other than to use the available toilets that have been constructed by the landlords. And having a toilet that can fit in their house was something appealing because it only it is required to be installed just somewhere in a small space in the house. A CBS toilet is an inclusive sanitation. This is a family-friendly toilet that can be used by everyone in the house, including children. In fact, one of our clients was a daycare center. It is a facility that flower farms that parents working in the vast flower farms around Lake Naivasha would leave their children when they go to work. The children who are still young and are not yet of school-going age. The facility was in three rooms in a rental, sharing with more than 10 single rooms. And the kids were forced to share their pit latrines with the adults, who at times, maybe during the night, would misuse the toilet and leave very early in the morning, leaving the daycare center and the kids to struggle using the toilet. But when we introduced Blue Box to this facility, the kids also were very happy to learn how to use the toilet, and they became more confident and more independent. The other benefit of a CBS is its potential of raising awareness on sanitation in the community. This is because introducing a CBS in the community always involved a lot of PR and a lot of branding, because in the community, it is still a new concept, and you're trying to talk to people about a difficult topic that they are not free to talk about. And so the customer acquisition process involves designing to involve the users in intervening for their own sanitation situation, thus empowering people to take control of their sanitation. We also realized that it was more interesting when you talk to people for the first time. If they hear about this concept from a stranger for the first time, they're a bit skeptical and they're afraid because they do not understand what you're talking about. While you compare to someone who has heard it from maybe a neighbor or a friend, a relative, they are more open-minded to try it. That's showing that sanitation is a community effort. Operating CBS has not been easy at all. It has had its own challenges, and one of the challenges is the gender role and decision powers. Well, sanitation is basically viewed as a women and children role in the household. Though the men are the main decision makers in matters affecting the household. For instance, we have a case that was very sad of a lady called Mercy. Mercy was a young mom. She had just delivered her first child through cesarean section. And her husband, equally a young man, a fisherman around the lake, could not accept the idea of having a CBS. So when we first approached them, we talked to Mercy at the absence of the husband. And she was very happy to have this option because she was struggling a lot using the pit latrine that they shared in the compound, which was outside a few meters from the house. But when the husband came, 3 days later, we had to go back and install this toilet. Despite the tears and the begging from Mercy, the husband will not allow the toilet because of cultural and taboos involving having a CBS in the house. The other challenge is it's hard to scale. It's been very difficult to scale because, like in Naivasha, it involves doing a presentation door to door. This means that the sales team has to households are able to pay and the cost of operating the toilet. This is from the point of collection and emptying transporting the waste to the treatment site. The other reason why it's been also hard to scale is about the cultural influence. It's still a taboo to talk about sanitation. And it's been very often when you approach a family and you start talking about sanitation, the environment changes. There's a lot of embarrassment. Some of them have to excuse themselves. And until we can be able to bring this into making it more acceptable topic, it's going to be very hard to scale CBS. Also, CBS is suitable in difficult environments. That also means operating in difficult environment, it's also expensive. We've operated in severe locations. For instance, where you see a path on a sunny day, the paths will not be there on a rainy day. We call them paths because they are not really roads. And if it rains, sometimes we are forced to go around more kilometers to access the household, which also led to over 3 years of servicing in the Kakuma refugee camp. We had less than 1% missed collection days. And most of this was because of seasons like the rainy seasons, due to access to inaccessible roads. The terrains are hard to pass. Also, poverty levels. For instance, in Naivasha, over 70% of the population lives in single rooms. These people they rent in a shared compound with other people, and the landowners always ensure to utilize every single space, and they only leave maybe a space that's for about 3 to 5 toilets to be shared amongst all the tenants. So without space for a superstructure for a private room, it is hard for the tenants to construct their own toilets. Among the successes of the Sanivation CBS is the fact that we have proven effective sanitation option. We have tried this. It is very suitable for places where it's very expensive to maybe have sewer lines, or the government has no intervention plans for probably the next 5 years. We've also proven the value in the circular economy through employment and recovery of the resources and the energy resources that otherwise would have gone to waste, and through sale of fuel that is recovered after the treatment and production of the recovered resource. Through impacts, we have safely treated over 300 tons of fecal waste from the community and saved over 50,000 trees, which therefore offsetting over 4,000 tons of carbon dioxide. The revenue from the recovered resource is close to 1.5 million USD, and through the sales of 600 tons of charcoal briquettes produced from the recycled energy resources. So we believe that CBS can only work in specific conditions. And these conditions are best like single customer. This means like if the government or a humanitarian organization can take up the cost of paying for the services, this reduces the cost of client acquisition, which is very expensive. For example, this is what we had done in Kakuma, where we had partnered with the UNHRC, and we successfully installed over 500 toilets. Other places are where we have their available private area to build infrastructure, because people still believe or would like private rooms for their toilets. Other conditions would be where there is difficult ground conditions like high water tables or rocky grounds on hilly areas. And also we realized that it will be more successful if CBS received subsidies. Apparently, CBS in Kenya incurs the full cost of operations and does not enjoy any kind of subsidies. And if this was possible, ideally from government or other institutions, then it will drastically reduce the cost burden on households who have to bear the cost of improving their own sanitation. Though, in conclusion, we still do believe that CBS is an important sanitation solution, and under specific context can provide the most cost-effective solution for households to access safely managed waste. And with that, my name again is Jane Mugo, and I can take questions.
Thank you so much, Jane. That was so interesting. And by revealing some of the challenges and really opening up the conversation around the difficulties and the requirements, you've really contributed greatly, I think, to our ability to have a useful conversation here about how to move forward in this area. So that's really very greatly appreciated by myself and others on the line. Lauren, I see that we have quite a few questions here. So over to you.
Yes, we have quite a few questions. We have a bunch that I think are relevant for Sanergy and Sanivation, particularly these questions from Cecilia about cost-benefit analysis. So I think I'm going to hold those for later in the discussion, but wanted to note that I do see them. Some of the questions specifically to Jane that I think we'll take now are, sorry, I lost my place. How Sanivation attracts new clients? How do they introduce their projects to communities? Do they rely on word of mouth? And then the question that Rebecca asked about, do the toilets?
So the first question, pardon?
Oh, sorry, I was gonna ask two, but go ahead, you can take the first one and then I'll ask the second.
I lost you after the second question.
Sorry, I was going to ask one more question, which is, do the toilets involve any?
You seem to be having some technical. Oh, sorry.
Sorry, maybe there's a.
Lauren, you're breaking up, at least from my end.
Oh. Well, that's not good.
Also, the collection summary from the our TSRs. Those are the toilet servicing representative. So we will give them a daily log sheet, and after servicing each household, there is the data they collect, then they bring back to their site, and we feed it to the computer. So we had that, and we had moved on through the CBSA Alliance to trying a Verisan app that can be used by all CBS organizations in a mobile application.
That was actually a great answer to the question about how to track sort of the monitoring and evaluation. But I'm wondering if the question was about that or about how to attract, how to bring in new customers. And if I remember, okay, you did comment it was very expensive.
Yes. Oh, I had attract. All right. So one of the ways that we did on attract, it's through referrals. We had to first start with the people that we already knew and branding. So when Sanivation, when they start doing the CBS, they hadn't come up with the brand name and the presentation until later when we hired a consultant from WRP and we created some branding. And for instance, the CBS, we call it a blue box, and had uniforms and consistency. So we started with what we knew to what we didn't know. So we started with the people who were close to the services or who had started, that is the staff and their relatives, and went getting more into the territories.
Great, thank you so much. Should we take any more questions, or do you recommend that we go ahead and ask David to present at this point? question for
I
Lauren.
think we should, and I hope you can hear me this time, move to David and then come back to these other questions in the larger Q&A.
Great, thank you. I think that's good advice. The question in my mind is where to, okay. So it's my pleasure now to introduce David Berendes. He is an interdisciplinary epidemiologist working at the Centers for Disease Control and Prevention. He's an interdisciplinary epidemiologist on the Global Water Sanitation Hygiene team in the Waterborne Disease Prevention branch of CDC. He is the subject matter expert for hand hygiene, both domestically and globally. He conducts applied research in M&E, monitoring evaluation, focusing on sanitation and hygiene associated exposures and their impact on health, as well as increasing the role of the environment in transmitting antibiotic resistance organisms. His training was in cell and molecular biology at Duke University, and his doctorate was in environmental health sciences from Emory University, where my niece is going to school. So I'm pleased about this. So David, over to you. I think it's really appreciated that you're tracking some of these important health issues. So please go ahead.
Great, thanks, Dr. Nelson. Can everyone hear me okay?
You sound perfect from here.
Yes.
Great, and hopefully you can see the slides. So I wanted to, so I want to take a different spin on this idea of case studies and present sort of 3 remaining case study questions that there may be for CBS. And I want to start also by acknowledging, as was mentioned, I'm really an epidemiologist focused on water sanitation and hygiene and sort of the public health benefits of WASH, as we call it. And so my introduction and work with CBS has really been through a lot of these organizations that have presented. So a massive thanks to them, especially Soil and Sasha Kramer, who introduced me 9 years ago to CBS when I was working in Haiti, and we did an evaluation there, and then continuing work that you'll see with Sanivation in Kenya. So Jane and Emily and their entire team in Naivasha, it's been a pleasure to continue to work with them. So I really want to start by, there we go, giving you kind of these 3 overview questions, and I'm going to focus on CBS in low and middle income countries primarily, just to kind of handle the context. So thinking about WASH practitioners who work on CBS, 3 main questions I'm gonna tackle are: 1, around how do we handle or contribute to addressing the threat of antibiotic resistant organisms, or AR organisms, that pass through sanitation systems. This might not be something that you're thinking of every day, but it's something that we're thinking of a lot, and we see in the public health sphere. And so we want to make sure that the WASH community is aware of it and that we're doing our part to address those issues. I saw you talked a little bit yesterday about institutional places to use CBS, and I want to expand on that a little bit to what we need to do to move CBS into institutions and particular healthcare facilities. And then a different topic, animal waste, and can we translate some lessons on safe feces handling for effective CBS to animal waste management, animal feces management, because in the public health sphere, it's becoming a very large issue that I think the CBS community as experts have have expertise to bear on this and could really help us answer some of these questions. So first, let me start with CBS and antibiotic resistance. So this graph on the right shows the kilograms of feces that carry ESBL E. coli. So E. coli are organisms that live in the guts of mammals, and ESBL means extended spectrum beta-lactamase producing. You can essentially think of it as an indicator organism for antibiotic resistance. It is an antibiotic resistant organism itself, and this is some modeling that my team and I have been working on for estimating for the different regions on the x-axis there, how much waste, essentially human waste, is carrying this AR organism. And in the colors, as you see, where it's going, through what types of sanitation systems, through the JMP ladder. So at least basic, meaning it's got kind of facilities that safely separate it from human contact, limited, meaning shared facilities, unimproved facilities, or no facilities and open defecated. The take-home kind of higher-level messages here are that by our estimates, there's about 1.9 times 10 to the 10, so that's about 19 billion kilograms of feces containing this ESBL E. coli, this indicator organism for antibiotic resistance, passing through sanitation systems on an annual basis. 2/3 of that is through at least basic sanitation, so the highest level of the ladder. So we might think that's a good thing, but I'll give you a little evidence in a bit as to why that still presents some challenges for us, unfortunately. And 25% is through unimproved sanitation or is openly defecated directly into the environment. And this is, of course, a concern for human contact. And as you can see sort of from the colors, that's the orange and the red colors on the graph, that's really concentrated in regions that have a lot of low and middle income countries like Africa, Southeast Asia, and the Western Pacific. Additionally, these regions, Africa, Southeast Asia, and Western Pacific, are going to continue to produce high levels of antibiotic-resistant organisms in fecal waste because of these high carriage rates and because of probably poor sanitation. In both of these graphs, they're just different models showing the same thing. On the x-axis, you've got the percent of global feces produced by a particular region, and on the y-axis, you have the percent of global feces that contain these AR organisms, or you can think of as antibiotic-resistant feces that are being produced. And in both cases, you can see that Africa, Southeast Asia, and the Western Pacific are producing at least their fair share or more, and will continue to do that through our modeling through 2030. In contrast to Europe and the Americas that tend to be on the lower end of production, because the carriage rates, the prevalence of AR in those communities is actually much less for various reasons, and the sanitation may be a little better. But there's still some remaining questions for sanitation overall with AR organisms. So one, we want to know really how effective is our existing sanitation technology in treating antibiotic-resistant organisms, because for any engineers in the audience, you know that our systems weren't designed specifically to treat antibiotic-resistant organisms. They were designed to reduce all pathogens in waste, but not target AR organisms that may have different mechanisms. So in high-income countries, even the safely managed or basic, the highest levels of sanitation ladder, are those systems are still hotbeds of antibiotic-resistant organisms and their genes. And depending on the technology, there's some evidence, it's still an emerging area, that there may be differential treatment effectiveness depending on whether an organism is resistant or not. We've worked with Sanivation in Naivasha to sample the influent going into and out of a wastewater treatment plant. So not a plant that Sanivation runs, but a plant that happens to be there. And we've confirmed that there are high levels of antibiotic-resistant discharge or fecal waste coming into that plant. Although, thankfully, today we haven't seen this differential treatment effectiveness in that plant specifically, but we're continuing to look at it. So in terms of the questions for CBS in particular, we need to apply some of these questions to CBS treatment methods. We need some evidence on how well do CBS treatment methods, including drying, heating, pH changes, or others, address AR organisms. Do they address them just as well as the non-AR organisms? That would be great. That's what we're hoping. So we're actually collaborating right now with Sanivation, collecting from their new fecal sludge treatment plant the influent and effluent, and testing both how it treats susceptible generic organisms and how it treats antibiotic-resistant organisms. And this is an area we're eager to collaborate on. We have a new method that's a modified IDEX, which is a water testing protocol that's pretty relatively inexpensive and easy to implement, and certainly have expertise having used this method with Sanivation, and had used this method previously, although not the modified version, with soil. So we've done it in a few low and middle income settings, and we're happy to collaborate and think about this question with other CBS groups. There's also this remaining question of how well do on-site treatment systems similarly address antibiotic-resistant organisms, and there's some work going on from colleagues at Temple University who are working in Uganda on pathogen die-off in pit latrines, but that would apply also to container-based sanitation and to die-off of antibiotic-resistant organisms. Okay, so that's antibiotic resistance, the question. I'm going to shift to CBS institutions, and really in healthcare facilities is going to be my main set of questions, or kind of questions to the audience here as well. So beyond households, where can CBS insert itself into institutional wash provision? One of the benefits that we see from the public health side and the wash side of container-based sanitation is that it's one of the few systems level technologies. It's not building a pit latrine and then eventually later we'll figure out how we empty it and how we get the waste treated. It comes with the emptying and the treatment baked in, which is really great for the public health folks who want to ensure this. We don't really care as much about the circular economy from a health side, but we do care that the waste is getting treated and there are plans to deal with that waste and have it treated. So it's really, it seems like it would be very helpful in institutions, because institutions at a district level, municipal level, certainly could provide a reliable source of waste or raw material that would kind of address some of these new customer concerns. What if a CBS organization could get online with an entire district's worth of healthcare facilities? Wouldn't that be a great source of raw material to use? And for those not aware, there's a massive initiative now in healthcare facilities to improve water sanitation and hygiene. And I hope that everyone's aware of this, but in case they're not, this is some recent data showing that about 2/3 of facilities, only about 2/3 of healthcare facilities in low and middle income settings had a toilet for their clients. Even poorer on the piped water provision and soap and running water. This is a real issue. Sanitation is a real issue in healthcare facilities. And the UN, UNICEF, WHO, and others have really spearheaded this with a global action plan, a call to action on water, sanitation, hygiene, and healthcare facilities. We as CDC are involved as that, primarily as evaluators of the work that's done. And there was a resolution passed by the World Health Assembly last year unanimously to combat and improve the water, sanitation, hygiene conditions in healthcare facilities. This is a massive global initiative that's ongoing now, and really is something where I think the sanitation side is not going to be addressed as well as it should be, and so CBS really has a role to play perhaps. And there are actually individual ladders coming out for institutional wash in healthcare facilities as well, for those that are not aware. So again, building on some collaborations that we have done with Sanivation, particularly in Kakuma, which Jane alluded to, where Sanivation has worked. Sanivation is actually piloting some of their CBS in a healthcare facility there. And there are a few questions that have come up, and this is still an ongoing project, so I don't want to steal their thunder. I think they really should present that at next year's conference. But there are some questions that have already come up that I think are useful to share and think about. One is this behavior change for users of sanitation of CBS and healthcare facilities. Not only how do you address the perceptions of CBS head on, but how do you teach people to use CBS quickly when you're in an outpatient or inpatient environment where you're not seeing them on a subscription service weekly basis. You're seeing them for the 3 days that they're in for a surgery, or for the 1 day that they're in to get their child's arm bandaged. On the personnel management side, how do you divide up the responsibilities between the CBS organization and the healthcare facility? Healthcare facilities can be very sensitive about who comes in to see their patients, and so where do you draw the line between what the CBS organization is doing and emptying and their ability to see patients? Should they be seeing patients? Physically, how do we move the waste around the environment? What PPE or personal protective equipment is actually required, and how can we safely move the waste? And are there additional considerations for particularly sick patients or certain pathogens? And what do we do in an outbreak setting? Unfortunately, we've had to deal with, at CDC, several ongoing outbreaks that are related to healthcare facilities. So, we do have to answer the question, what if Ebola came to this healthcare facility? What would we do? Would we shut down all the sanitation operations and change things? How are we going to deal with that sort of setting, or those considerations? And then on the design side, are we tied to existing CBS organizations for offsite treatment? Or do we have to then move to start in healthcare facilities where there is an existing CBS organization, which is what we've sort of felt like we've had to do at this point in terms of piloting and evaluating this work, which is really what we want to do? Or could we design sort of a CBS in a box type approach, or some approach where the healthcare facility maybe has consultation from a CBS organization, but isn't geographically tied to where the few CBS organizations are working? All right, so one final topic, talking about animal feces management itself. So this is some work we did estimating global recoverable feces from animals and humans. And just to show that the darker colors are higher ratios of animal feces to human feces, and the tighter together the lines are, is also the higher rate of change, or the larger the increase over the last 10 years or so in ratios of animal feces to human feces. All this to say, at a very high level, the largest change in animal feces ratios to human feces are in low and middle income countries. We know that as countries get richer and develop, people consume more animal proteins, people use animals more, and so there will be more on-site animal feces, and that presents a public health hazard. From our estimates, about 30% of households had animals on site, 933 billion kilograms of feces. Animals were 2/3 of on-site feces. So again, as water sanitation and hygiene practitioners, this is kind of surprising because we really focus on the human feces side, but that's only 1/3 of the on-site feces. So we need to figure out a way to deal with animal feces, and unsurprisingly, it's concentrated in low and middle income settings. So there's been a call to integrate animal feces management into WASH itself. Animal feces, as you may have encountered already, is often viewed as a resource primarily, and as being less pathogenic than human feces. But of course, animals can still shed pathogens like Campylobacter, Salmonella, Giardia, Cryptosporidium that infect humans and get them sick. So how do we deal with this? Farmers will tell us, well, it's a resource, so I want to make sure that we retain the nutrients. So what am I supposed to do with my waste? Well, there's a lack of small scale or household scale feasible treatment guidelines that maintain the nutrient or resource quality of the waste for reuse. From what I know from talking to CBS practitioners, CBS is all about keeping the resource recovery and keeping the resources in the waste. So could CBS provide smaller scale guidelines, best practices, personal protective equipment guidance, handling guidance, things like that, that could relate to these smaller scale animal feces management and help us answer this question of how to safely manage the pathogens in animal feces while still reusing that feces also for land application in some settings. So just to sum up, we talked about antibiotic resistant organisms and the need to test those within sanitation systems and CBS systems, and maybe even use CBS systems to help monitor discharge in communities. The potential for there's a potential for an expanded role of CBS in institutions with new guidance, and especially this new guidance would need to be around the rapid behavior change for healthcare facilities and considerations of personnel management and designing the system, and how do we necessarily need to tie these healthcare facilities to a CBS organization geographically if we're starting to pilot CBS in healthcare facilities? And finally, animal waste is a massive on-site hazard with a need for household level, household scale treatment. Could CBS provide some guidelines or some guidance for approaches that would be feasible for individual farmers to take, that is not so onerous on them, but still helps them better safely manage the waste before they land apply it, and could help improve public health overall? And with that, I'll close and just give my contact information in case anyone wants to contact me afterwards as well. Thanks.
David, thank you so much. Very stimulating set of issues that you've presented here. Many new to me, and I'm guessing to some others on the line. So thank you so much for that. And let me ask if anybody, let's give David a couple of specific questions to him, and then we can open up the floor to the panel as a whole. So thanks again, David. Lauren, over to you.
Great. I'm going to read two questions that came up that are specifically directed for David. One is from Alejandro Molina Garcia, who asks, do plans exist to treat hospitals' water? all the patients' excreta is going into the sewage. Is there treatment, residual treatment? Are there microbioma with antibiotic resistant bacteria going in there? Is there a technological solution to this? And David, I suspect that that'll be maybe a little bit location specific. So maybe you can share some examples of how that is done in different places with different regulatory frameworks. And then I'll just read one more second question from Sahil asking, on animal feces, do you see changes in regulation in some regions of the world to reduce antibiotic use in animals?
Great. Yeah. So on the healthcare facility question, sanitation is a very strangely dealt with issue when it comes to healthcare facilities, because there are all these provisions that are put in for protecting patients and protecting healthcare staff from individual person's blood and during surgery and other sorts of procedures and things. But really there is less so when it comes to sanitation, we've found in a lot of the work we've done. It's sort of not understood that whether the waste is more pathogenic, less pathogenic, more antibiotic resistant as you suggest, or less. That's kind of an open area. We know that that the waste is going to be hazardous, and one could argue it may be more hazardous than general waste, but it's often still dealt with by the same organizations who are emptying everyone else's pit latrines, for better or worse, with the same use or lack thereof of personal protective equipment. So I think that that's an area really where the science has kind of lagged, and that's kind of why I think that baking in or bringing in CBS or other areas to bear on this and kind of give some guidance on treatment, aside from sort of incineration of hospital waste. That's been the one area where there are some standards, but that's really around solid waste, not fecal waste. It's incinerating sharps containers, things like that, and there are specific guidelines for how hot that needs to get, things like that. But I think there really is a gap there to be addressed from the side of sanitation and treatment, and ensuring that there are regulations and the right treatment protocols set up when you move something like infectious fecal waste or someone shedding pathogens in their fecal waste off-site, off of the facility to be treated. As for the second question, the need for regulations in animal feces, I do think that is, I think that there's a need for regulations on the handling side of things, certainly. I think that there is some, it's beginning to be recognized also on this antibiotic use question, although that's not as much what I'm focused on, because we still, whether or not we use the antibiotics, these animals may still be shedding pathogens in their waste. And so I think that it's really, there's been a large push to make this a One Health sort of framework, where we're not focusing solely on humans as the public health outcome. We're saying, well, it is worth it to give the animals good water, sanitation, hygiene, so they become less they become less sick. And I think that would relate to your question about reducing antibiotic use, because if you have better conditions for animals, then you're going to have less need for antibiotic use, and certainly less prophylactic, quote unquote, antibiotic use. So I hope those are helpful answers to some of those questions, but great thoughts that are still not well answered overall in the community.
Great, thanks so much, David. Do you think it's time now, Lauren, to open up the floor for the general discussion?
Yeah, we have a lot of questions still sitting here. If I can read out, we have a couple that I think are more pointed to Davis that we didn't get to relating to his presentation. Julie is asking for him to elaborate on the point that he made about Evergrow decreasing the effect of chemical fertilizers. And Sahil was asking Davis if the energy consumption relating to the transport of the waste sort of to be processed and then the fertilizer back out to the cropland, if that's a large component of your product, and are there any ways that you've thought of to minimize your energy consumption? So we'll start with those two and then I'll ask a couple more.
Yeah, so thank you for the questions again. The question on reducing the effect of chemical fertilizers. What is simply maybe what I mean in this is that repeated application of Evergrow helps nutrients become more available to crops and makes the crop more fertile. And also in terms of availability, this being a natural nitrogen, a natural nitrogen fertilizer, then it is a slow release fertilizer which releases nutrients longer over time as compared to the inorganic fertilizers which are fast release. And then by making the soil more fertile and also making the nutrients available over time, then it then leads to less chemical fertilizers, less chemical fertilizer use. That is the inorganic fertilizer. So you end up using less of the inorganic fertilizers. So basically, it's if the effect of inorganic fertilizer might be either environment-wise, it might be the cost-wise when you're talking, when we see, because when you're using less of the inorganic fertilizers, the farmer tends to use to use to invest less in farming and then reap more benefits. And just to clarify is that for now, because as I said, one of the challenges we're having is the mind change, the changing of minds of the farmers to pure organic farming or pure organic fertilizer application. For now, we tend to use Evergrow as when we're going to the market, we tend to market this as a complementary product, not as a replacement product for the inorganic fertilizers. So that's why I'm saying, like, over time, because if maybe, for example, I may share some material. For example, on what I'm sharing right now, someone asked about the composition of our fertilizer, and you can see in terms of the essential, the major nutrients, it's low as compared to the inorganic fertilizers, which are majorly made to concentrate on the essential nutrients. But if you come to the living matter or the organic matter, you see now that's where from carbon we have a very high carbon percentage, and also the CN ratio, and and the organic matter which helps create a living soil then is also high. And so what we are saying is the decreasing the effect is basically trying to reduce the either economically to the farmer, or also in terms of, and if the inorganic fertilizers might cause any environmental harm, or maybe it might degrade the soil because of overuse, then that is what now Evergrow comes and helps with. But as I said, a lot of challenges so far in terms of trying to change the mind of the farmer from the fertilizers they were born planting and farming with to the new way of inorganic fertilizers, and also trying to convince them that what we are producing is fully decomposed and as a balance of all the nutrients, as an element of all the nutrients available, as compared to the manures they use for the cow and goat and chicken manures they use. In terms of transport and the energy cost, and energy related to that, energies related to that is first of all we make sure that we don't collect, because we have centered our operations in the urban poor areas, that is the slums. We make sure that we have that in those areas you have a very huge populations and a very dense network of people. So what we do is, and the toilets, because a slum is a very small concentrated area, then the toilets are basically are around the same area, but now many of them. So we collect a lot of waste, and then before even transporting them to our central processing facility or recycling facility, we have a collection center. So our collection center, we aggregate waste from different toilets installed in different parts of the slums in which we're operating in Nairobi. And then from there, if we have an accumulated or an aggregated waste, that is sanitation waste, that is when then now we transport it, making sure that we are not inefficient in terms of truck usage, and also that we are transporting as maximum as per new, so that we avoid a lot of energy use, transporting small bits of the waste from one place or from our toilets to the slum. So the fact that we introduced the consolidation center even for the hotel waste and the agricultural waste, then that makes sure that we have like efficient and fully loaded trucks going to a processing facility, and that reduces the energy consumption and emissions which might be related to that. Yeah, so I'm not sure like that's what the question, or maybe if I've answered the question as per the person who asked, but that is one thing which we have used. And then now from that is one method we have used. And so now when we recycle the waste, then also we have the same model whereby we have satellite warehouses in areas we operate in. So we transport the fertilizer in bulk and then now distribute it from there, rather than having many small trucks moving from our central processing facility trying to reach the farmers or the resellers who are stocking our product all over the country.
Great. Thanks so much, Davis.
Great, thanks. I'm actually going to also ask maybe that our presenters and speakers turn their cameras back on, since we're not showing the slides anymore. It's not quite as engaging without the cameras. So the next couple questions, thanks so much, Davis. The next couple questions that I think, hi Jane, that I think would be really interesting are the ones from Cecilia asking this cross-cutting question around cost-benefit analysis. So she says, regarding operational costs and environmental costs, are there ways to understand whether the total costs, including for the environment, make this type of initiative worth investing in, even though the operational costs might sometimes be more expensive than other alternatives? She's asking if Davis or Jane have experience with public-private partnerships, smart subsidies, or anything else that has sort of made it easier for you to operate. And her other sort of follow-up for that is perhaps the other cost benefits to add here, based on what Jane presented, are the cost to human health and well-being, particularly for vulnerable populations. And I think that's something too that David could weigh in on.
Okay, I can go first. So as I was saying that at the moment, none of our sites, our CBS sites, is operating. And because we do not have any subsidies from the government, and the cost of operation is quite high. But it is worth it, especially for people, elderly people, and people living with disabilities. I have a story of one of our customers. His name was Andrew. Andrew lives with disability. He was born unable to stand up straight. So he crawls on fours, and he lives alone and has to use a shared latrine, which is very frustrating, especially during the rainy days and at night. So he really enjoyed having a CBS in his house. So if it's possible, or the government or institutions will come up with policies to reduce this kind of cost, it will be very beneficial for the community, for special need people, as well as families. Yeah.
Yeah, and also maybe to add on that is, as Jane mentioned, that there are a lot of challenges in the CBS model, and one like also from Sanergy's perspective is that to have like to be very efficient, you basically have to have a very dense network of operations, and that is why at Sanergy, we are always trying to get leads and trying to work in terms of units, so trying to concentrate an area as much as possible so that we can have as much waste as possible from a very small from a small area. And other benefits which also, and apart from even the cost involved there, what also these container-based sanitation facilities help in is are even more than the availability of a toilet. I may speak of where we operate, that is Nairobi, and Nairobi slums are basically very unsafe. So having a place to go to the toilet at night, as Jane mentioned, is a tall order. And what do people do? Because they can't go out at night, they'll be robbed or they'll be mugged or they'll be attacked. So they just, what they do is take a paper bag, poop in a plastic bag, and early in the morning they wake up and throw over the roof or out the window. And as I showed you a slide of a Nairobi river which passes through Mathare slum, which is one of our area of operations, and all that waste then goes to that river, polluting it. So and that is a source of water for all those people who are living in slums, because there is no sewerage at all. There is no the water facilities provided for them. So they'll end up drinking that water, deteriorate, which has a negative impact on their health. And also they also farm with the same water, which is very polluted by any kind of waste which they are collecting, which is being tapped into the river, which is not well treated. Also, they'll sell those crops of which have been farmed by that water to the residents living in the same slabs, and so it's a circular loop of disadvantages to the people living in slums. And those are other benefits which the CBS, apart from the cost related questions, those are other benefits which these CBS facilities come in handy for the users, as Jane mentioned.
Yeah, I would just add, I think that Davis hit it absolutely correct, that there's all these other benefits that are health benefits, security and just dignity of having a place to go to the toilet. We often, and my sector, the public health sector, is to blame for a lot of this. Often health gets operationalized as the absence of disease, but it's not, and measuring disease is very difficult. So really, I think it is absolutely useful and to think of a cost benefit or a health benefit to having improved dignity of having a toilet, having improved security for women and girls, especially at night. All of these other mental health benefits that come with secure, safe, accessible, dignified sanitation that CBS and others can provide. So I think that that's absolutely a key part to measure and factor into the equation when groups like Sanergy and Sanivation, as they're doing, are providing services, is to measure those impacts and those benefits to the community itself.
Excellent point. Thank you.
So Rebecca had asked a question specifically to Jane about whether or not her toilets involve dry matter in the solid chamber of the toilet. Actually, she also said same question to Davis, and I just want to flag that they answered the questions in the chat. So in the case of Jane, she says her CBS being a dry toilet, it uses char dust to eliminate smell and absorb toxins from the poop. And Davis also says that the Sanergy toilets are urine diverting, so solid waste and liquids go into 2 different chambers, and that they're using sawdust as a drying agent, and that it also helps eliminate the smell.
Yeah, thank you so much for that. Yeah, do you mind if I barge in with that, my other part of the question? So taking into account that we have now these 2 chambers, and there's a nice organic matter that's even been supplemented from what the user has deposited, and then you have a chamber with this sterile, rich urine component that is a demonstrated biofertilizer in many contexts. So I'm just kind of wondering, are there any urban agriculture, farming, gardening opportunities that might take advantage of some of the urinary and even if there are sort of short loops, plant nutrient loops that could be taken advantage of? Are there enterprises that might be, I see that these are environments that are extremely crowded, and that's a hallmark that's desirable, as Davis has just pointed out, to the enterprise. But I also wherein, you know, you go one layer up and keep your garden on your roof. I don't know, I'm just wondering, is there any room, is there anything going on in that area or room for innovation? Maybe also wondering if Jane would comment on in a more Naivasha environment, which is perhaps a little bit less crowded than a Nairobi environment, although around Nairobi there might be also spaces. You do see some farming going on. So anyway, anything to the urban agriculture opportunity?
Yeah,
Well,
they are very okay. Okay, Jane, go first, and then I'll maybe
yeah, I just
follow
wanted
up
to
there.
say there is nothing we do with the urine. We just pour it in a soak pit, and around Naivasha, we are yet to see anyone utilizing the urine.
Okay, thanks. But you do have a lot of agriculture right around Naivasha, certainly. I'm just curious about
Yeah.
the use of that. Okay, thanks.
Yeah, and also maybe Nairobi might be like urine, as you've mentioned, is a very rich nutrient source for, especially for essential nutrients like nitrogen to farming. And it's sad to mention that the areas we operate in, the Nairobi slums, even thinking of getting, we even struggle to get a space to put up a toilet. So leave alone having a place to have a small garden to supplement your kitchen. So that's a big challenge. And also even if you talk about roof farming, the structures in Nairobi slums are usually very feeble, and going a layer higher to do such kind of thing would be very dangerous. And so what we are doing is currently that we have urine fertilizer development in our R&D pipeline, that is research and development pipeline. And how you're seeing it is maybe now having 100% recycle for the, because we're doing the feces, now we do the urine and have and now do a commercial urine fertilizer, rather than trying to tell the people in the slums to do farming with urine, which is very viable, especially in the circle gardening and things like that. Opportunities which might arise might be on the other side of Nairobi. Nairobi is divided in two sides. We have the urban poor and the urban rich. Those people have gardens, but now trying to, that is the kind of market we are looking at. If we might be looking at if we are to develop something like this.
Wait, sorry, Davis, that was a very, very interesting answer, but I feel like I missed something. Is there a niche? I see that you're absolutely understand your point that for these ultra dense areas, which are actually most favorable for you commercially, they're the least favorable for any kind of gardening. But is there any intermediate space that's sort of, while not ideal for your collection scenario, might be feasible for sack gardening or other approach?
Yeah, of course, in the middle income and the high income and areas of Nairobi, people do gardening, sack gardening, and people who have their own compounds. You can't do this in a residential plot because they don't allow for that mostly. But for people who have compounds, and we have a lot, but now in the suburb outside, in the outskirts of Nairobi, which might make the logistics now become a bit difficult for us, unless it's a willing person who is ready to collect and do everything for himself. But now, as I mentioned, like the only model we can only think of, especially based on our area of operations, is trying to develop a reuse technology for the urine, and then now making it a product to buy from the shops, rather than maybe providing urine for the. But as I mentioned, Nairobi is very potent. We have all kind of people who do farming in their own compounds and stuff like that.
Great. Okay, thank you very much.
Great. I'm going to go back to a question from the sort of higher top of the chat. We have two questions from Luc Girard. I believe this is more in response to Davis, but our other panelists can weigh in. He's saying, compared to developed countries, anaerobic digestion is commonly used for biogas production. How come you're not producing biogas? And the second question is, given the presence of solid waste, has anyone checked or had any issues with the presence of heavy metals in their fertilizers?
Yeah, so maybe to go into that, biogas, I never mentioned biogas because, okay, we have in our site, in our recycling facility, we have a biogas plant, which now we direct some of the waste collected into that plant, because we also collect waste from the pig industry and also the excess feces which we cannot recycle at the current facility, directed to that, and that is used for normal and like basic powering of the plant. So it's an idea, but it's not the biggest because now what I talked about is what we are going commercial with, and not looking at biogas for now, because we think these are the other streams, especially the fertilizer and the animal protein, attract the biggest market currently in Kenya, and the need of them are quite higher than biogas. But biogas, we have it in-house, and we power some of our operations on site using biogas. Heavy metals, it's a problem, and but for any product which is going out, we make sure that we are within the set, because we have heavy metal concept, we have heavy metal traces in our fertilizer, but not above what is recommended as in the standard set by the Kenya Bureau of Standards. So we test for them, but within the minimum ppms allowable for a release of product into the market. So the address is there. We can't deny the other fact, but the problem will be if now we have an excess than the required concentrations by the standard set by the Kenya Bureau of Standards.
Thank you so much. So we have another question about, so in Jane's presentation, she had a couple slides on some of the challenges that they faced in sort of implementing and scaling up their project. One of the ones that also came up in this discussion was the challenge of how expensive it is to recruit new customers, which we talked about a little bit already. The question is whether or not Davis is experiencing similar challenges to Jane and how you overcame them. So I think, that's something that Davis can answer, but I would elaborate that as well. On Wednesday, the first day of our conference, one of the discussion points was whether or not the key challenges in expanding this are in the technology space, in the policy space, if the frameworks are supportive, or in the socio-cultural space around taboos. The panelists on Wednesday said that economics is a real big obstacle to implementing and scaling these solutions. So after Davis maybe specifically addresses whether or not he has the same challenges that Jane shared, I'd be keen to hear from Jane and David about what they think are sort of the biggest bottlenecks to implementing these solutions and taking them to scale.
Yeah, so challenges, what Jane explained is we experience those challenges, especially on the toilet side when we are trying to install the toilets in the slums. Jane talked about the taboos and the cultural connotations around that, and that is something which also we try to educate the masses as much as possible so that they can actually adopt this idea. We try to show them the benefits other than the demerits which might be brought by the taboos or the cultural beliefs they stand for. Another thing is also slums. In slum area, our challenges might be a bit different from Jane's problems, because we operate in slums, and these areas have a lot of unemployment. So we have to market this as an employment source for the people living in slums, because if you can't go installing a facility in areas where people don't have employment, and they are, and then you expect them to maintain it. So what we do is we franchise these toilets, and they are owned, and because you have to pay for sanitation sanitation service, so we franchise them to people in the slums, landlords, schools which are located in the slums, and then now they charge per user, and then they get income from that. So that is how we have tried to circumnavigate that problem of making people actually employed to the idea that they can use these toilets, and how they can use it. Apart from the benefits we talked about, security, health, they can also become an income source, and people make a lot of money if you charge around $0.1 and you have 100 people visiting your toilet at the end of the end of the day. You have $10 in your pocket. So that's one way you are trying to overcome that challenge. And other challenges were when we were starting, the government was not very receptive of the idea, but now we have tried to work around policy and trying to influence policies which would support this kind of sanitation facilities, so the container-based facilities. So we engage with the Ministry of Health a lot to create policies which favor this kind of a model. Because before, when we were installing the slums, we were installing the toilets in the slums, our people could even get arrested because it was something which was not acceptable even by the government. So we have tried to work that through a manipulation, or maybe trying to influence policy also, so that we have favorable policies which can actually support this kind of sanitation service in urban poor. Because in any case, the government is doing nothing and cannot provide sewerage facilities for people living in slums. They are very dense, and they are, compared to our model, the cost of having a sewerage system in a slum would be tenfold expensive than having a container-based facility which we are servicing every day.
So I hate to interrupt the discussion, but we have now got Professor Adama Hilou on the line for Burkina Faso. So we've had two presentations from Kenya today, as well as David's presentation from the Centers for Disease Control and Prevention. And may we try to get Professor Hilou's presentation to the group, but are people willing to have one more talk, now looking at the situation from West Africa? Professor Hilou was scheduled to be one of the speakers in our first session on Wednesday, and so far he's the only speaker not to have been able to come across with his presentation. That would be an excellent chance for us maybe to see his talk. Okay, so Lauren, if you're willing, can you get that going? I could also do it from here if that's better.
I'm working on it right now.
Love that insect background. Woo. All right. I at least can see Professor Hilou's presentation. Are others okay? Prof. Hilou?
Yes. Yes. Do you understand me?
Yes.
Yes.
Okay. Yes, I am Adama Hilou from University of Ouagadougou, and I would like to make a very quick presentation on waste flow in West Africa.
Yes, please proceed.
Yes. Okay. Normally, I wanted to at first give some definitions about waste, but I think that as we have not so much time, I will go more quickly. And what we can say about waste are unwanted or unusable materials. What can we say about waste flow in West Africa?
Dr. Hilou, just keep saying next if you want me to keep clicking through for you. Sorry.
Okay.
I would just add a request to be a bit brief, because we would love to have time to be able to discuss a bit afterward.
Yeah, yes. I want to go directly to the West African aspect of waste. What can we say about the waste flow from West Africa? We can say that solid, fluid, hazardous or non-toxic waste is generated in West Africa households, offices, schools, hospitals, and industries. How this waste is handled often depends on its source and characteristic, as well as any local, state, or national regulations that governs its management. It is an obvious statement that there is not nearly enough being done to resolve the consequences of the past mismanagement about waste, because there was a lack of innovation and unfortunately completely apathy. In West Africa, about 80% of waste is produced by households. More waste is generated in the urban areas than in the rural areas due to the increase in living standards in and the consumption of wrapped and packaged goods in urban areas. There is a lack of proper infrastructure, and fast-growing population contributes largely to increased waste-related concerns in West Africa. Many toxic pollutants are a major environment concern due to burning garbage in the cities, for example. We have many byproducts from burning which are very toxic, like carbon monoxide. And also today we have this problem with electronic waste, which is growing in West Africa. And also, since about 10 years, we have a new problem, which is the shipping container with waste coming from many other countries like Europe and Asia. In front of all this problem, there is a massive lack of waste management systems in West Africa. And about 2% of the waste is recycled. And what is the consequences? What are the consequences of this situation? One of the consequences is many diseases which can be more increased with the best management of waste. Yes, we can go through. We have here some examples of waste. I would like to speak more about the case of Burkina Faso. Burkina Faso is one of West African country. Burkina Faso is an hinterland country which have some characteristics. We have about 20 million people, and the GDP per capita is about 2,077 US dollars. And the urbanization rate is about 25%. We have here some data about the geography of Burkina Faso. In Burkina Faso, we have many urban cities. The biggest is Ouagadougou. Ouagadougou is the capital city with about 3 million people. What is the origin of waste in Ouagadougou? In Ouagadougou, the waste comes from domestic activities or industrial activities. Waste production is about waste production is per capita about 0.7 kilogram per day and per person in Ouagadougou. And what is the disposal of waste in Ouagadougou? We have much of waste in Ouagadougou is managed and thrown and swept or in ditches. We have only 8% of households who have the garbage bin or trash can. We can say that about 46% of waste are evacuated in Ouagadougou. We have here some pictures of the handcraft management of waste in Ouagadougou. We have some small companies which try to manage the waste in the capital city of Ouagadougou. Despite this situation, we have many concerns about waste management. We have many difficulties to evacuate the waste in the city. Here we have the map of Ouagadougou. We have about 5 districts in Ouagadougou, and we show here the waste management quality in the districts. We can say that the red shows that there is a very low management of the waste. We can see for the blue, we have a kind of management which is, I can say, acceptable, and it is in the inner city, in the downtown. We have this a kind of quality of waste management, but in the most part of the city, we have very bad management of waste. What is the composition of waste in Ouagadougou? We can show that there are 3 quality of waste in Ouagadougou. We have the organic waste here, and also some waste we can be recycled, and other waste which we can be very difficult to manage. What are the consequences of this bad management of waste in Ouagadougou? There is many pollution in Ouagadougou because sometimes people used to burn the waste, and this can create a very big pollution concern. We have also many diseases which came from the bad management of waste in Ouagadougou, and many toxic effluents which are produced from this waste not well managed. And also, this bad management of waste in Ouagadougou have many social consequences, because sometimes the poor people are very concerned with this waste, because in the downtown, we can have some infrastructure for waste management, but many times in the suburban, we have no facilities for the waste management. And sometimes when the government wants to build some facilities, they used to go to the suburban and take the lands to use to build this infrastructure. And also, we have this international traffic of waste, which can have many consequences in other countries. Also, the waste management can have economic issues. For example, sometimes the money the government used to manage to build infrastructure for waste could be used for other needs like education or for food. Because in Burkina Faso, we have about 40% of the population, we are under the, can be considered as poor. And also, the non-management of waste can be a very, very difficult problem for agriculture. Because we have many pollution of the soil, many heavy metals are polluting soils in Burkina Faso. Burkina Faso is a a country where a big percent of the population live with agriculture. Also, waste management, when it is not done by a formal economy, is also opportunity for informal economy. But these people who work in the waste management, they are exposed to many difficult situations. We have here a picture showing how people in Ouagadougou, the poor, used to go to sort the waste and try to find anything to feed, to eat or to sell. What possible solution for Burkina Faso and West Africa? Here in Burkina Faso, there are many attempts to try to manage waste. The first is handmade solution. Many people, many non-qualified people try to use material from waste and try to transform them into something they can sell. Here we have some pictures showing the results of handmade solution from waste. We have here a waste trash made from waste. We have here also some results, and also all these are the results of handmade solution from waste here in Ouagadougou. Another solution can be the composting. The composting was proposed as solution, I can say 40 years ago. There was many projects. We want to compost waste, organic waste for agriculture, but many of these plans for waste composting have failed, because I think that the economic business was not very good built, and also there was many difficulties for composting organic waste in West African countries. So today this solution seems to be not a very sustainable solution. So there now we think that our society is expecting new solutions. For example, the biogas is something which can be promoted with organic waste. Also, biocare can be also something, but we think that the best solution can be the recycling the waste. The province, yes, we can go. Many of previous solutions failed because of non-complementary of actors and sectors. This week, changes made the cost of transport and compost production unsupportable by cities. There was no regional or ecological approach. But an ecological approach is possible because cities absorb products from peri-urban and rural areas. The consumer's waste is not completely evacuated and managed, and that produces pollution and insalubrity. We think that ecological organization of activities between the three components, cities, suburban, and rural, will be effective for recycling the waste, organic waste. For example, in Ouagadougou, we have many peri-urban gardening because as in many West African countries, we have many people coming from the rural areas and they are not qualified and they cannot do another work in the city. So they can only do agriculture. So these people, much time, are using agriculture as activity and daily activities. And we have many peri-urban gardening. And for this gardening, there are needs of fertilizer. And fertilizer is very expensive in Burkina Faso because, as I said it, Burkina Faso is an hinterland country, and the chemical fertilizer are very expensive. So, and also everybody knows that chemical fertilizers have many bad consequences for the soil and for the human. We think that an agroecological gardening promotion will consume more compost and excreta or urine or biochar produced from organic waste. That can be very interesting for peri-urban and rural area. In addition, we think that the recycling of other components which are not organic, that can be very useful also for the people in the city to have money and also other earning. And we can think that the ecosystem can be a good solution for West African countries because, as we have said it, we have a big concern about waste, particularly organic waste management in the cities. And in the peri-urban area and rural area, we have a problem of fertilizer because fertilizers are very expensive and not very accessible. We think that from the city, we can use the organic waste, for example, the feces and urine. We can collect this matter and use them in the peri-urban gardening or in the rural agriculture. This can be a very good way to try to close the loop from all the food coming from the rural and peri-urban area in the city. And so from the city, we can send for the peri-urban and the rural area fertilizer will be used to produce more ecological food for the cities. So we think that there is much possibility from ecosystem promotion in West Africa, and we think that we have many change to be able to find a solution for waste management and also how to feed our soils.
Well, Adama, thank you so much. This is a perfect note on which to end. It is now 11 a.m. and we are formally out of time. And I just feel that that's been a really nice, the timing was perfect and we've just ended exactly on time. And I want to thank yourself and everyone else. I think that your comments have sort of shown potentially some interesting differences in different contexts. I think that that's another rich topic that we can explore going forward on our beautiful Mobilize website.
Okay.
So I want to invite everyone, please, to come to the presentations. You can hear them again. We can contact each other and keep moving forward with this discussion on the Mobilize site. So thanks again to Lauren and Linda for setting that up. Thanks to SDSN for sponsoring this event. And thank you so much to the presenters and to everyone who's participated. It's been a wonderful event and I thank you again.
Okay. I am very sorry because I think that maybe the pronunciation was not very good. And also I should have presented on Wednesday. I am very sorry.
Well, better today than better that we got you in, Adama. So I feel that I feel very fortunate to have had the chance to hear from you and to have your voice and perspective represented in this wonderful event. So thanks again, everyone.
Okay.
Here.
Thank you very much.
Any final words, Lauren?
No, I just would say thank you to all of our presenters and participants, and I hope to see everybody on Mobilize in the coming days, and we'll be posting the videos and the slides there. So stay tuned. It'll take a little bit of time for the video to process, and then we'll upload it. Thank you so much.
Okay,
Thank you
really,
very much.
well, excellent work, everyone presenting today. Much appreciated. All the best.
Yes.
Thank you very, very much.
Thank you for hosting.
Okay.